everyone, welcome to our channel. Today's topic of discussion is about diabetes guide on fruits. So can people with diabetes eat fruits? Is the most common question that many of us come across. In fact, if you have diabetes, someone would have advised you to avoid having fruits as they are high in sugars and can increase the blood glucose level. Well, let's burst this myth today. Now, fruits are high in nutrients, fibers, antioxidants, and all of these are needed for healthy body functioning. Thus, fruits are an essential part of our dietary plate. And this holds true even for people with diabetes. Now, people with diabetes can eat fruits. In fact, it is the best way to get all the nutrition while satisfying your sweet tooth. However, it is important to understand that fruit contains fructose, a type of natural sugar that is present in it. And after eating this gets converted into glucose. So all the fruits you eat gets converted into glucose. Thus, for diabetic patients, it is important to consider the number of fruits eaten. Now, a person without diabetes can have about 4 to 5 servings of fruit. But if you have diabetes, you can have about 1 to 2 servings of fruit depending upon your blood sugar control and also by balancing the overall carbohydrate intake. Now, you can enjoy your favorite fruits by reducing the quantity of chapati, rice to adjust the carbohydrates coming from the fruits. Now, along with the number of fruits eaten, it is also important for patients with diabetes to consider the glycemic index of the fruit. So let us understand what is glycemic index. Now, glycemic index is a rating system of carbohydrate containing foods on the scale from 1 to 100. This score indicates how quickly the food can rise the blood sugar levels. So in general, high GI foods are the ones that can cause blood sugar levels to rise rapidly compared to the medium glycemic or the low glycemic index foods. So let us look at the low glycemic index fruits. Now, low glycemic index fruits are the ones with GI of 55 or less. Now, people with diabetes can include about 100 grams of these low glycemic index fruits daily along with their normal diet. But if your blood sugar levels are well in control, more servings of low glycemic index fruits can be included, but not all at once, but spread it across the day. So let's look which are these fruits. Now, low glycemic index fruits include apple, oranges, sweet lime, guava, pear, peach, cherries, strawberries, avocado, and jamun. Now, let's look at the medium glycemic index fruits. Now, these fruits are the ones which has glycemic index between 56 to 69. Now, people with diabetes can include these fruits, but only in moderation, that is not more than 100 grams of these fruits per day, or avoid them depending upon the blood sugar levels. So these medium glycemic index fruits include muskmelon, papaya, pineapple, banana, grapes, mangoes, chiku, figs, and raisins. So let's look at the high glycemic index fruits. Now, high glycemic index fruits are the ones that have GI of 70 or higher. Now, people with diabetes should avoid these fruits or consume in very small quantities, that is 1 to 2 pieces of high glycemic index fruits depending upon their blood sugar control and as recommended by the doctors. So let's look at these high glycemic index fruits. Now, these include watermelon, overripe bananas, and most of the dry fruits like dates. To sum this topic, fruits with low glycemic index are good for diabetes. And if blood sugar levels are well in control, then small amounts of high GI fruits, that is 1 to 2 pieces of high GI fruits, are okay to have and as recommended by doctor. Along with this, it is important to consider the form in which the fruit is eaten. That is, have fruit as whole, that is in cut form with skin wherever possible, and avoid fruit juices. To know more about chronic diseases like diabetes, heart disease, lung disease, gastric disorders, as well as brain and nerve disorders, send hi on WhatsApp to 8451 058451. Do like, share, and subscribe to our channel.